Welcome back. Perhaps your resolution for 2014 is to lose weight. Well, we got some great tips on how you can do that. And if you need to lose more than just a few pounds, we're going to tell you how you can do that as well. Here's Dr. Richard Follwell. Dr. Follwell, it's great to have you on the show. How are you?
Very good. Thank you for having me down.
This is a big time of year for you, I'm guessing, because as we talk about resolutions, I think the most common one, correct me if I'm wrong, is I want to lose weight, right?
Oh, absolutely.
Sure. So we're going to talk about a bunch of different stuff, but we're going to start with if people want to shed a few pounds non-surgically, what are some tips that you can give them?
One, they need to be on a diet that they can hold true to. For example, if you decide to go on a crash grapefruit diet, you get pretty miserable within a couple of days. So make your diet realistic, something that has normal, healthy-based foods. And I also recommend get someone to join you in your weight loss venture. That way you have someone to be accountable for with.
Yeah, I think that's a great point. It's really hard to do it by yourself, right?
Absolutely.
Yeah. Where do you stand on cheat days? You know, because you hear so many different like fad diets and different personal trainers say you can eat pizza on the weekends. What do you think about stuff like that?
Cheat days, really, no, those don't work so well.
No.
You know, do you have a cheat day with your wife? Absolutely not.
Yeah. The last thing I want to ask you about that, and then we'll move on to some of these really cool things that you got here, is time of day that people eat. You hear so much about don't eat carbs after 6 p.m. and things like that, but just talk me through meal size as the day, you know, turns from day to night.
The thing that I really encourage is not eating a large meal and then going straight to bed. So, you know, dinner, don't eat dinner and 15, 20 minutes later go to bed. So, right. Depends on your physical activity during the day. If you exercise before breakfast, you're going to have a huge breakfast because you're going to be starving. So I always recommend a good, healthy breakfast to start the day.
Well, talk me through what you got.
So the people who really need surgical measures are morbidly obese, people who are more than 100 pounds overweight. So to lose that weight on your own can be quite a challenge. But we do have several surgical tools that we can offer to people that will help them achieve their weight loss goal. Now, it's not just as simple as coming in and having an operation and go away, goodbye, you're going to lose your weight. So the operation is just a basic tool to help you get started. And then we have a program that's inclusive of dietitians, psychiatrists, psychologists, and follow-up to help you keep on track.
Because it would be a terrible thing to go through all this, to have the surgery, and then revert to your bad habits.
Correct.
And
so
then, yeah, you get nothing out of it.
We follow up. I tout if you come to our program, you'll be married to us for life. So we're not going to just follow you for the first 6 months. We'll follow you for the rest of your life, help you keep on track, and keep you updated with the new nutritional information that we have.
So first talk to me about the actual surgery. What happens? How does it work? What do you do?
The surgery is a process, extensive education before you have surgery. So we want our patients to be comfortable, one, with the clinic and their surgeon, and two, be very, very well educated about each procedure that we offer. So the 3 procedures that we offer are the lap band, the laparoscopic sleeve gastrectomy, and the laparoscopic Roux-en-Y divided gastric bypass.
That needs an acronym, I feel like, that one.
It does have one.
Does it? Okay, good. It needs one.
It needs one. So why don't we start with what's touted as the least invasive of the procedures, which is the lap band. So lap band is a small silicone device that we place around the top portion of the stomach to restrict the food once it gets into the first portion of your stomach. And the great thing about the band is we're able to adjust it, make it tighter or looser in the office. So it's touted as the safest surgical procedure. We do not change any of your anatomy. So we don't cut your stomach, we don't divide your stomach. And if for some reason we need to remove the band, we can. So I have a
go ahead.
Cool little model here of what the band looks like. And this is the stomach. This band, of course, we don't cut your esophagus to put it on. It locks in place. But we place the band around your stomach. And it creates a small pouch about the size of a golf ball. So this golf ball pouch gets full very quickly. The band then restricts how quickly or slowly that food empties into your old stomach.
Okay.
So you eat a small portion of food, you get full very quickly. And then once it goes into your old stomach, you get full normally. And then we have a small port that we place onto your muscle. Most people cannot feel it. Obviously, you cannot see it because it's under the skin. And this is what I access in the office to make your band tighter or looser.
So, can you even become obese again? I'm sort of fumbling for the question, but I'm just thinking of, I've seen people who've had the surgery. Doesn't it prevent you from ever getting that big again, even if you eat like a pig, for lack of a better term?
No, absolutely not.
Okay.
As I said earlier, these are a tool. So I use this synonym with my patients. If you go to the department store and buy a lawnmower, put it in your garage, and go to the Keys for 6 months, you come back, your lawn is not going to be mowed.
Okay.
So this is a tool. And I also tell my patients, everyone thinks I'm the big part of the picture. That's absolutely not true. I'm the small part.
Right.
I do the surgery and provide you with your tool. And you, as the patient and the program, are the people responsible for making that tool work.
So even with this, if you still eat poorly, which is why you said you're with them for life, checking on their follow-up, if you eat poorly, you're going to stay obese. You're going to regain the weight or whatever.
Correct.
Yeah, okay. All right, a couple minutes left, so take me through the other...
The sleeve gastrectomy, once again, this is the stomach. It looks similar to that model. We divide the entire length of your stomach, making this a narrow sleeve. It's about the size of a banana, or as you would say here, banana.
Right.
So you're left with a banana-sized stomach. This white portion here is about 85% of your stomach. We remove that completely. This is the portion of your stomach that stretches and allows you to eat more. This portion that remains does not stretch. So once this pouch gets full, you're satisfied, you're done after a very small meal.
What happens if you want to keep eating?
If you want to keep eating, this muscle here called the pylorus stays closed as it would in you and I today.
Okay.
So that no food can go through, so it's just going to keep backing up until you throw up.
Oh,
so
lovely.
It's a forced behavior modification.
Okay.
But it's a great surgery with good weight loss. A little more invasive. There are a few more potential complications because we are removing your stomach.
Sure. And there's another procedure as well?
And there is another procedure, and that's called the Roux-en-Y gastric bypass, or shortened RYGB. So this, we go up to the very top portion of your stomach. We divide your stomach, make it about the size of a golf ball. So your new stomach is about the size of a golf ball. We go 6 feet down the road and bypass your small intestine and bring it up to make a connection. So you eat much less food with your golf ball sized stomach, and then all that food that you eat is not absorbed because it's bypassed 6 feet of intestine.
Fascinating.
So,
man, wow, really, really cool stuff. But I guess the moral of the story is if you start taking better care of yourself now, maybe you don't have to worry about these
absolutely.
things. Yeah. If people want to reach you, how can they do that?
You call Good Samaritan Hospital to the Bariatric Center, or you can call directly to our office at 561-622-1420.
Doctor, it was great to see you. Always enjoy it, and we'll see you again soon.
Thank you very much.
All right, thank you. Thanks, Doc. When we come back, we're going to help you get organized in your home and in your life. Stay tuned.